Hi, let's see an NCLEX RN video based on care for patients with HIV. You know that when a person is infected with something, the CD4 cells, that is the infection fighting cells, will be activated. The CD4 cell is a type of T lymphocyte with CD4 receptors on the cell surface. These cells are also known as T helper cells. So when any antigens are infecting a person, the CD4 plus cells releases cytokines. This cytokines activates the B lymphocytes and killer T lymphocytes, thus destroying the invading organism. In HIV, the CD4 plus cells are activated, which in turn is not able to destroy the viral organism. Let's see the care of patients through this video. The nurse has received the following orders for a patient with AIDS who has recently been admitted to the unit. Which order should the nurse question? Hepatitis B vaccine third dose, live virus influenza vaccine, tetanus vaccine, pneumovax vaccine. So here live virus vaccines are contraindicated in HIV positive patients. And all other vaccines we need to give. An updated immunization should be given to the patient to protect from infection. Nurse in the clinic has assessed several patients. It's a priority for the nurse to suggest follow-up for the which of the following patient. The patient that reports chronic intermittent diarrhea for 6 months, difficulty swallowing food for 3 days, missing one dose of ART in the past week, non-detectable HIV viral load 3 months ago. So here the patient with difficulty swallowing, that is a symptom of esophageal candidiasis. That is an opportunistic infection that is related to low CD4 plus count cells in HIV positive patients. So that patient should be seen in priority. Diarrhea is a common thing in patients with HIV, and if it is chronic and intermittent, it's not a big priority, but diarrhea can lead to hypovolemia. That just need to be noted. Missing one dose of ART is not much important, and also non-detectable HIV viral load. That is a very good thing. Which of the following HIV positive patients is at greatest risk of developing TB? The patient with CD4 plus count greater than 200, a cough and fever, a positive PPD, recent pneumonia. So, what is meant by positive PPD? So, here PPD means purified protein derivative. For a patient with a TB, ongoing screening should be routinely done every 6 months. So if this patient has a history of this positive purified protein derivative, that is PPD, and interferon gamma release assay, IGRA, such as the blood test quantiferon TB Gold, it can be used to screen for TB. A positive test, it always requires further evaluation for a current TB infection also. You are providing care for a patient newly diagnosed with HIV. Which nursing intervention is an essential priority in your plan of care? Dietary restriction for a soft diet, evaluating behaviors for depression, reverse isolation to reduce infection risk, teaching exercise and weight loss strategies. Of course, when a patient is diagnosed with HIV, the patient will go for depression. So we need to evaluate for that. We don't need a reverse isolation, but we need universal precautions. And we need weight maintenance on gaining strategies, not losing strategies. And dietary restrictions should not be there. You are counseling a patient who has just been tested negative for a possible HIV exposure. Which of the following statement indicates your teaching can be effective? I need to get tested again in 6 months. Of course, the patient need to be get tested again in 6 months, even though they might have been found negative during the first test. I won't need to continue using protection. No, they need to. Because I am negative, I don't have HIV. No. Because I tested negative, I can't infect anyone. No. Which of the following statements regarding viral replication is correct? Endotoxin or exotoxin is required for viral proliferation. Must use host white blood cells for viral proliferation. Pathogenic replication is facilitated by the administration of antivirals. Replicates by preventing phagocytosis by WBC. You need to understand that viruses reproduces in WBC only. When a person is infected with HIV, the viruses cause an inflammatory reaction and brings the WBC and macrophages to the site of the inoculation with the virus. And this HIV virus, they will be attaching to the CD4 plus cells. And the CD4 plus cells and co-receptors, and then through the cells they will enter the cell, and inside the cell the viral RNA is changed to viral DNA using the enzyme reverse transcriptase. The viral DNA is then integrated again with the CD4 plus cell, and the HIV DNA is in charge of cell reproduction and produces new viral protein. So here they must use host white blood cells for viral proliferation is the correct answer. A nurse is caring for a patient in the emergency department. The patient asks for an HIV test. The nurse explains that a screening test can provide quick result and determine whether more testing is necessary. That test is a CD4 plus count cell, ELISA test, rapid test or viral load. So here diagnostic or screening test assess for antibodies to the HIV virus. The rapid test or point of care test utilizes the blood or oral fluids, and they will see for the presence or absence of HIV antibodies for further screening. Rapid tests, they don't require a laboratory to perform this test, and the results from the rapid test is available in 5 to 30 minutes, which depends on the test which is being used. The nurse understands the correct statement about HIV diseases which of the following. HIV disease is diagnosed by determining the viral load. A CD4 plus count of 600 cells per microliter or more indicates HIV, not AIDS. A CD4 plus count of 200 cells per microliter or less increases the chance for opportunistic infections. Antiretroviral therapy is started immediately after diagnosis if the CD4 plus count is less than 200 cells per microliter. So, the correct statement about HIV disease is a CD4 plus count of 200 cells per microliter or less. That increases the chances for opportunistic infection. So, let's see the next slide. For seeing the classification of HIV infection in adults and the CD4 counts. HIV infection stage 1 is told when there are at least 500 cells of CD4 per microliter. Stage 2, 200 to 499 cells per microliter. And HIV infection stage 3 is told when less than 200 cells per microliter. That time we will tell it is a AIDS defining condition when the cells are less than 200. Being the cells irrespective of the number of cells, we can tell the patient can be infected with HIV and AIDS when other opportunistic infections the individual is having, which is known as the AIDS defining condition. That is, HIV infected individuals have AIDS when the CD4 count is less than 200 cell per microliter, or when he or she is diagnosed with one or more AIDS-defining illnesses. Commonly occurring AIDS-defining illnesses are pneumocystic kidney pneumonia, Mycobacterium avium complex, toxoplasmosis, esophageal candidiasis, and recurrent bacterial pneumonia. A patient states she has recently been treated for gonorrhea. Her last HIV test was 18 months ago. When you review the orders, you notice that an HIV test has been ordered. What do you do? Explain that the test has been ordered and she can opt out. No discussion is necessary, just do the test. Obtain her written consent for the test. Provide pre-test counseling before getting consent. So according to the current recommendation, we should offer an opt-out screening for the patient between the ages 15 to 65. Yearly testing is recommended for at-risk individuals. A patient newly diagnosed with HIV asks about community support group. What should the nurse do? Contact psychiatry for an evaluation for depression, provide a list of groups in a neighboring community, request a referral to the social work department, suggest a family to contact the physician. Of course, you need to provide a list of groups in the neighboring community for support. A 45-year-old woman who presents to the emergency department with mild difficulty breathing for the past 2 days when walking. She has had increasing fatigue for the past week. Prior to this, she has been relatively well, except for several outbreaks of genital herpes in the past 6 months. The last outbreak was 2 months ago. She is currently on no medications. Her husband died of a blood infection 4 years ago. Vital signs for Ms. Mary are temperature 98 degrees Fahrenheit, pulse 104 beats per minute, blood pressure 100 by 50 mmHg, respirations 28, pulse oximetry shows 92% on room air. She is put on 2 liters of oxygen via a nasal cannula. A peripheral IV is started. Blood is drawn for a complete blood count and metabolic profile, and she is started on 0.9% normal saline 100 ml per hour. Initial diagnostic results have confirmed HIV positive. Low WBC, CD4 plus count of 125 cells per microliter, mild anemia, normal renal and liver functions. She is experiencing symptoms of pneumocystic kidney pneumonia. The common symptoms are a dry persistent cough and mild shortness of breath with activity that occur over several weeks. Patients often experience weight loss, fatigue, low-grade fever, hypoxia. Her healthcare provider provides orders of PML, cryptosporidiasis antibiotic prophylaxis to treat her pneumocystic kidney pneumonia. Consideration is given to preparing her to start antiretroviral therapy. So this is the case. The patient is diagnosed or confirmed with HIV positive and the CD4 cells counts are very less, and she is showing symptoms of pneumocystic kidney pneumonia, and the person or the provider has started with antibiotic prophylaxis also, and her liver and renal function tests are okay. Miss Mary is briefly admitted to the hospital for an evaluation. The charge nurse is reviewing her orders. It's a priority for the charge nurse to follow up with the provider about which order. Stop antibiotic prophylaxis, CD4 plus count in the morning, apply PPD, dietary referral. So of course you know that the CD4 plus count, if it is less than 200 and the patient don't have any renal and liver problems at that time, of course we can go for an antibiotic, especially the patient is not allergic to sulfa, Bactrim is a recommended prophylaxis, so we should not stop the antibiotic. CD4 plus counts in the morning should be checked, and also for TB it should be PPD should be tested and dietary referrals should be done. The nurse caring for Miss Mary incorporates which nursing diagnosis into the plan of care? Imbalanced nutrition more than body requirements, ineffective denial related to refusal to acknowledge diagnosis, risk for infection, risk for other directed violence. Of course, the patient who is positive with HIV, there is a risk for infection. When the nurse teaches Miss Mary about the ART, she will soon start. Which of the following will be helpful in increasing the patient adherence? Centering drug taking on a daily activity, direct observation for negative side effects, increased frequency of drug administration, using multiple drugs whenever possible. So here, of course, centering drug taking on a daily activity, that should be emphasized. There are different classes of retroviral medications, mainly 6 are there. One is nucleoside reverse transcriptase inhibitors, NRTI. That includes the tenofovir and abacavir. Then there are non-nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, CCR5 antagonist, integrase inhibitors, and post-attachment inhibitors. So these drugs the patient need to adhere when they are given. Direct observation is needed for at-risk population. Here it is not required. And also when we are increasing the frequency of drug administration, when we are doing multiple drugs, the compliance to these drugs won't be that much good. Which of the following would you include in your teaching plan of Miss Mary? Decrease the risky behaviors, emphasize exploring experimental treatments, implement universal precautions at home, evaluate measures to decrease exposure to others. Of course, the patient should decrease the risky behaviors. Which statement by Miss Mary indicate that teaching has been effective? Anyone who touches me needs to wear gloves. I can use alcohol in moderation with my medications. I can take my medications late if I am out of the day. I need to use condoms with every sexual encounter. Of course, the patient needs to use condoms with every sexual encounters. Others are all wrong. We need to know about different opportunistic infections which comes with HIV. They are pneumocystic carni or girovecchi pneumonia, Mycobacterium avium complex, toxoplasmosis, esophageal candidiasis, especially the cryptosporidiosis candida esophagitis, recurrent bacterial pneumonia, TB, syphilis, cryptococcal meningitis, cytomegalovirus, progressive multifocal leukoencephalopathy. These are the common opportunistic infections which is seen with HIV positive patients. Other complication of HIV disease is immune reconstruction inflammatory syndrome also. This occurs as the CD4 cell count increase and the immune system is able to respond to the presence of previously acquired opportunistic infection. Hope you understood this video. Thank you so much for watching. Please do subscribe.